Hi there. Welcome back to the new season of the podcast. I'm Dr. Christopher Nolikin.
And I'm Dr. Lindsay Renzullo. We're so happy to have you guys back after the summer. Did you have a good summer, Krista?
Sure. I mean, it's a different summer than usual, right? So It seems like it just flew, and now we're already in September. So That's where we are. And now not really going back to school in a normal way, right?
No, not at all. No. Yeah, it was definitely a different summer for sure.
So today we have Jared Katz, who is our talent acquisition manager. Did I get that right?
Yes.
Okay.
Yeah.
Because it flew out of my head again. So he's here to talk to us about careers in our veterinary hospitals and sometimes even probably administrative roles, all the different roles that we have in veterinary hospitals, especially Ethos, but perhaps industry wide. I think that the reason that we started discussing this is we get these, Lindsay, all the time, these reviews. And you know how much reviews, like sometimes they're great and sometimes they just irk you to no end. And frequently the review says, why don't you just hire more people? You just need more people. It's too many cases and not enough people. So we thought bringing Jared on to talk a little bit about that and talk about the challenges of hiring in both COVID, but also not associated with COVID and before all of this would be a great idea. And then maybe that'll prompt a few people who are listening to apply.
Fingers crossed.
Yeah.
Yes, double fingers crossed.
Yeah. So Jared, tell us about what your role is within Ethos.
Yeah, so I'm the talent acquisition manager for Ethos, and so I lead the recruiting efforts for the organization. So our job as a team is to help attract and find the right talent to join our organization across the country, and to also share with them what the opportunities that we have available. So whether it's going to do virtual career fairs now in a pandemic, or going to when we were able to do them job fairs around the country, talking with students about opportunities, both clinical and non-clinical, that are in our industry. So what I do is really generalized. So I don't have a specific industry that I have to work within, like a veterinarian or a vet tech or a client care specialist. And so I can do my job from anywhere. But being part of an organization that is committed to making business decisions, and looking at how it's going to impact our employees, our clients, and our patients is really empowering. And that's one of the things that I love about working here. Of course, I love the people I work with. It goes without saying. But the fact that we are committed to making evidence-based decisions that support all of those areas of our business, and including our referring community in the decisions that we make, is really exciting.
And you're responsible not just for the careers that are in the veterinary field that are medically related. You sort of have a good grasp on a lot of the careers, correct?
Yeah. So it's really interesting. I think people hear healthcare or veterinary medicine and they think, all right, you're going to be a doctor or you're going to be a technician or a nurse. And there's so many other avenues to go in within the veterinary field that really afford you the opportunity to make an impact, not only for our patients, but for our clients as well. So if you wanted to do customer service, we have got plenty of customer service roles. Or if you like supply chain, if that's something that really interests you, there's that whole avenue. We're really multifaceted. We really function as a holistic business ecosystem with so many different avenues for you to go into. But what's great about it is that Ethos, well, at least for me, I'm able to see the impact of the work that I do. So the work that myself and my team, though I'm not providing direct patient care, I get to see the impact, like you were talking about, Krista, the reviews online. When people write those reviews and say how wonderful an experience, and I get that back to someone that I hired, it's really exciting to be able to see that.
So let's maybe go through kind of a little bit of the different roles that you hire for. We always say, like, it takes many years to grow a baby vet, right? So you have to, your veterinarians don't just grow on trees. And so when we are talking about the ER right now across the country, ERs are absolutely slammed.
Yes.
So people are everywhere waiting 3, 4, 5 hours to be seen. And that's a byproduct of this situation that we're in right now. And the fact that you can't just say, boom, let's hire 6 more vets, as much as Lindsay would like me to always. She just So what do you do to hire various different veterinarians? What's your general recruiting scheme there?
For veterinarians, I think we're trying to share the message of what Ethos is about and who we are and what makes us different from some of the other organizations around there. And really the emphasis for us with hiring veterinarians is that we are a national organization and we're proud of the size that we are as an organization, but really you have that very local and individualized culture. So the both of you work at Bolger Veterinary Hospital, but if you work at Boston West Veterinary Emergency and Specialty Hospital in Natick, Hinton, you're gonna have a very different culture there. But the level of medicine is still the same, but just it's a different family environment than it would be at Bolger, or if you're working in Wisconsin or Chicago or Virginia. So really having that individualized culture within each of the locations. So I think that's really, I think, one of our primary reasons. I think the other piece is around, and I'm sure you maybe have talked about this in other podcasts, is that we really take an evidence-based and a science-based approach to how we practice medicine. And we're really proud of the synergies that we have with Ethos Discovery, which is our nonprofit arm to our organization. And then, of course, our emphasis on continuing education and our partnership with VetBloom, which is our online learning platform. I know I've seen both of you do CE lectures on VetBloom. So having those 3 components is really our primary drivers, really is exciting. And of course, the opportunity to work with the 2 of you.
Of course. Well, and I think that's, the interesting thing is that what I've found throughout the years is that, we've kind of embarked upon a lot of different little initiatives through Ethos as a whole. So a specialty that is less common might be one that we jump off a ledge and say, oh, hey, maybe we should try this, And so just because we don't have a job opening necessarily posted may not mean that there isn't a job to be had. And sometimes it's worth those specialties reaching out. We never would have thought about really hiring an anesthesiologist until, one kind of fell in our lap and we were like, let's try it,
Yeah.
So that was, our first anesthesiologist. And then at Bolger, our anesthesiologists were kind of things that we did because someone, kind of came to us. So,
yeah.
Well, I think that's what's so great about Ethos is that, being with the company as long as I have, and you guys have had longevity too, Krista, as well. I mean, is that the company is constantly changing and growing and developing. And I don't feel as though it's a company that's just been stagnant to work at, right? Where, what I've, the building I walked into, 20 years ago was not the same building. Well, it actually isn't the same
physically
building.
not.
Physically, but as far as what we try to do as a company is so different. We're constantly trying to get better. We're constantly trying to do new things. And it's just been a very exciting company to be a part of because of that.
Yeah. You both make a really good point. I can probably think of 5 people off the top of my head who came to Ethos, who presented to us and said, you don't have this now. This is what I can do for you. Or this is how I think I can transform this part of your business. And this is how I want to do it for you. Whether you're a veterinarian or in a different type of a role, there's no harm in asking, because the worst thing that someone's going to say is no. And so asking is a really important part of that. And I think we've been able to build other services at other locations because somebody asked. We have a cardiologist at our hospital in Hawaii because she asked. So I think there's just one that comes to mind off the top of my head. But I would say nutrition at Mass Vet as well. We didn't have that. We didn't necessarily have the intention, but those 2 people came forward and said, we think that this is valuable for your geography. And we said, okay, we'll listen, and then let's talk about it. Absolutely.
And like moving away from vets, then when we look at other careers, like within the hospital, the technicians is another one that just I think of as well, trying to recruit more technicians and what makes, Ethos a unique hospital for these technicians. And I mean, on my perspective, I can see a lot of the benefits that these technicians can get from our company. We have a very interesting sort of like platform for them to sort of learn and develop and get better. We have different levels for these technicians and their skill sets that they can grow and develop as they move on towards the different levels. I find super exciting for these techs, and the techs that come to our hospital that may have been practicing, and been working in a veterinary field for, years, say, holy cow, like I'm doing so much more than I've ever done before. That's a great feeling.
Yeah, absolutely. And I think I'll make a plug for our partnership with Purdue University, the Vet Bloom and Purdue University Vet Tech Nursing Program. So we employees who participate in the program get a discount to be able to complete their degree as a veterinary nurse. So there's that emphasis on continuing growth and opportunity. I'd also say that being a technician at Ethos isn't always about providing immediate direct patient care. I have come to learn there comes a point in a technician's life where they're just tired of lifting that 150-pound dog up off of the floor, or wrestling that not so puppy on the floor because they're trying to play with you. And there's alternative career paths for technicians who are looking to continue to use their skill set, but maybe you're just can't get on the floor one more time. And I totally respect that. And so we have so many other career opportunities, especially in a world now where we are doing things more virtually. Having those relationships with our clients and being able to, please correct me if the right word is triage, to triage a client over the phone, or be able to give the client an update on their family member, to know what's happening, but having the clinical expertise to be able to do that is so critical. It might feel, there's maybe a perception, if we were to call it like we in Ethos we call it a concierge, but if we're calling it something that seems more customer service-y, there is certainly a component to that. But what we're looking for and what we're asking for is that your knowledge and expertise to be able to do those things. And of course, if you want to provide direct patient care, we are not going to say no. And if you want to work third shift, consider yourself hired.
So if you want a job as a veterinary technician as your life goal, there are very many different ways to go about that. And you should think about those kinds of opportunities that are offered by, vets in your area, perhaps Ethos or other vets around.
Yeah. I think a career change can be really scary for a lot of people. And you feel like you have to go back to school and reinvest and take out student loans and do all of these things. But I think if patient care is something that you're excited about it, and you want to see the immediate results of your work, looking at something like, and of course I have to make a plug for Ethos's vet assistant training program, but it's a hands-on paid training program where at the end you're eligible to sit for a certification to become an approved veterinary assistant. And so it's exciting that it's hands-on work, which I think that right now we're all probably a little hesitant in the world we are in right now, but it's that hands-on training. So you're not just sitting behind a computer being lectured at for 8 or 10 hours a day, but it's really experiencing and it's very immersive. And so you can make that career path change, or that total sort of left, making that very hard left into a different arena. And it's not so hard. And you don't have to take that investment.
Right now, let's just talk about like the state of the world. Their unemployment rates are super high. People are now, who were furloughed, are now being told, no, you're just laid off.
Yeah.
So now maybe, a reasonable time for people to consider these kinds of changes, whether it's these jobs we just talked about or, some of the other ones that we may talk about. The veterinary industry is one so far that has been actually overwhelmed during this situation and needs more people.
Yeah. And I would also say, if you're not sure about veterinary medicine, if you think it's something that you're interested in, but you're not quite sure, we also have opportunities for people like that. So you don't have to go into the training program. So we are hiring people who we may call them runners, or we call them curbside attendants. So they're people who are that intermediary between our clients, the physical intermediary between our clients and our nursing staff, and are helping to bring patients into the hospital so that we can keep our nursing staff and our clients safe during that transition period, and so that everyone gets to work at the top of their capabilities. And so if you like to be active, if you don't want to sit behind a desk and you want to be able to provide that customer service, those types of roles are also great opportunities for you to just sort of put your toe in the water a little bit and see, is this what I want to do? Is this what I like? But without having to make that full commitment in the long term to make a career path change.
Yeah, I think oh, go ahead, Krista.
No, go ahead.
Oh, I was going to say, I just think that, you can't overemphasize, how busy the veterinary field has really become. And the fact that we are excited about having, more people, or we want to hire more people to sort of, have our hospitals run smoother and have the experience be better. And so this is one of those times where it is a perfect time to get involved if it's something that you're thinking about. And like Jared has mentioned, there's just so many different roles that it is great that you can really figure out what's going to be best for you.
Yeah.
Can I ask a quick question on that topic? What are some of the differences that COVID has brought for the application and interviewing process?
Yeah, that's a great question, and I would definitely love Krista and Lindsay's help with this. But I can certainly, from a larger standpoint, or from a higher level standpoint, we aren't bringing candidates in for in-person interviews as much as we used to. Where our hospitals have gotten a lot better about asking more questions that are value-based. So understanding how somebody works and asking for examples of how they've interacted with fellow colleagues. In the geographies that it's nice out, we are doing socially distant interviews outside, where it's safe to do it, and you're not sitting in the sun for 20 minutes. But also, and for those of us in the Northeast area, we're getting into the cold mornings, which is my favorite time of the year. But when we start to make those changes, we're gonna have to adapt again. But we're doing video interviews. And I think what's really important from a candidate's perspective, don't be nervous when you're on a video interview. It's just like a face-to-face interview. Try to be in a place that is distraction-free, both for you, but also for the person that you're interviewing. So try to do it in a place with a neutral background, or there isn't a lot going on in your background. And if you don't have a laptop and you're just doing it from your phone, that's totally fine. I can't tell you the number of times that I've dropped my phone while FaceTiming with a friend or a colleague, and it's just like, uh-oh. But they get to see my ceilings for a minute while I go to pick up the camera. It's okay. Those things happen, and we're all human. And just remembering that that life happens. And I think we're trying to be a lot more understanding and accepting and being flexible with what candidates are looking for. So I think we're asking candidates what their comfort level is. Mm-hmm. So what do you want to get out of the interview? So it's not just about us. An interview, I make an analogy. Interview is like dating. You have to like us and we have to like you. And so there's that it's very much a partnership. And now we're asking a lot more questions about, how do you feel safe? What is going to make you feel comfortable? This is what we're doing now, but what else can we do to make you feel comfortable? And we're also giving them advice in advance of coming in is, just for example, don't shake people's hands, stand a little bit farther away. I'm someone who likes to extend my hand out to candidates when I first meet them. So I put my hands in my pockets now when I go to meet people so that I physically don't do it, so that I have like that barrier. So giving candidates that advice on how to do that. On the non-veterinarian side, we're trying something new this upcoming weekend. We're doing a drive-through job fair, actually at Bolger, where candidates for entry-level positions for technicians and client care or curbside roles, they'll actually stay in their cars, and then we'll come up to their window and interview them, and then make a decision from there. So we're trying definitely some new opportunities.
And it's a much more pleasurable experience than the drive-through testing. See, we're not going to be stuffing
right. Well said. Yes. Yeah, absolutely. Yeah.
I love the drive. I think this is like such an innovative idea. I'm just like, I love it. I'm really hoping it's a huge success, just because I feel as though it's a super cool idea and it's just great thing to do, especially right now.
Yeah, absolutely. We're looking forward to it. So it's at Bolger on Sunday from 10 to 2.
Nice. Yeah, and that, kind of segues a little bit into some of the non-medical things that we hire for. We have a lot of customer service representatives that, their job has changed over the last bunch of months, and eventually it will go back, probably, maybe, to what it used to be. But there is a wide variety there too of people who are front facing with clients, to people who are largely answering telephones and trying to do phone triage and answer questions that way. They, a lot of the time, are people coming not from the veterinary industry at all. In fact, most of the time when we hire customer service representatives or telephone people in our service center, I see their resumes and they come from a huge wide variety of backgrounds.
Yeah.
So yeah.
I think you don't have to come from the veterinary industry to have one of those kinds of roles. I think
Right.
if you have a passion for customer service, if you have a passion for helping people, and you like being active, if you are the kind of person who wants something different throughout their while they're working, every minute to every hour, it's a great opportunity. And you don't have to come from our industry.
Right. We can teach you
Absolutely.
what you need to know. Jared, are there any other job, I don't want to say like job openings, because that's not really the whole function of this podcast.
Sure,
It's like advertising our jobs. But are there any other job categories that you wanted to highlight besides those are the ones that we talked about that are like physically within the hospitals? But then there's sometimes some other administrative things.
Yeah, so I think we're continuing to evolve and grow as an organization, and so there's many other opportunities that are probably going to be coming available, whether it be in a facilities role or supply chain. I'm looking to add to my team as well, so that we can continue to hire great talent. So it really can vary.
IT. What about IT?
Yes, we are actually. We have 2 IT positions open. Yes, absolutely.
Yeah.
Thank
Right.
you for
So you
that.
don't think about that, right? Like you're
Yeah.
an IT person, maybe
Yeah.
with a tiny little interest in animals,
Yeah.
or not, right? You could
Right.
work with us and not care about animals in any way, but be able to work with us lovely people who have no technical knowledge at all.
Correct.
Yeah, we really don't.
Correct.
We really don't.
It's
Especially
supposed
Lindsay.
to plug into the
Especially
wall.
me.
I know that's about it.
Turn
right?
it on. Turn it on.
And I mean, Jared, if people want to go and learn a little bit more about us, obviously the website is probably the best place for them to go, correct?
Yep, they can go to ethosvet.com, or they can go on Facebook and look at any one of our hospital websites. So if you have a hospital that's close to you, you can look at any one of our hospital pages, and you'll see our job openings on those pages as well. We are hosting events. We're partnering with Indeed.com. They're offering virtual career fairs for different organizations. So if you go to Indeed and you look for virtual career fairs, or Google is going to also be your best friend. You can look for virtual career fairs in your city or in your state, and those will come up as well. Google indexes those, and so it's a great opportunity if you just want to see what's out there as an opportunity to see what other companies are offering.
Great.
My advice for candidates as they're looking for opportunities and interviewing is to ask the employers, how have you protected your employees? How have you kept your employees safe? And what are you continuing to do to keep them safe? For those that have children who are of school age, whether that be elementary, middle, high school, or even college, what is an employer offering to be able to help alleviate some of the life stressors that come with working and taking care of kids in a pandemic? And so ask your prospective employer what they're doing.
One question I think many applicants might have is what has Ethos done for employees throughout the country, throughout all of our hospitals, locations, as well as the home offices?
Yeah, that's an interesting question. So I think Ethos has really taken a very conscientious effort to protect the safety of our employees while they're working, and making a concerted effort to protect our employees when they're at home as well, and make sure that both their physical and mental well-being is being taken care of. And I think that the two of you can speak to this in probably more detail because you're providing direct patient care. But those of us that work in our home office, worked in the home office, we've been working from home and working remotely to be able to try to social distance and protect our colleagues. We only go to the office when we need to. At the beginning of the pandemic, Ethos instituted a separate sick policy for those that may be at risk or have been exposed to the virus. And so we continue to offer that to employees, and as the CDC has made changes, we've continued to refine and clarify that policy as well. Most recently, Ethos contributed or provided a bonus to the majority of the employees in the organization. And it amounted to about $1.2 million in bonuses for our employees. And it was just as a recognition to say thank you. And I can't thank my colleagues enough for the work that they do. And we become much more conscientious about saying thank you and showing appreciation, because it's not necessarily about the money. It certainly helps, especially in this time when grocery prices are getting more expensive. It certainly helps. But I think just saying thank you and showing appreciation to each other has really helped.
Mm-hmm. Yeah. And I mean, some of the other like nitty gritty things, like we were all freaked out. Lindsay especially. No, just kidding. At the beginning of all of this, right, we didn't know really what to do. And we were getting some contradictory information from, the CDC and various places about what to do with masks and that kind of thing. And so, the company as a whole really supported the team members in saying, okay, you don't have to make these decisions. We're telling you what to do. This is how you do these things. And maybe they have evolved. For sure they have evolved, because there were times when we were really worried we weren't going to have enough surgical masks to do surgery, right?
Yeah.
So we do have rules, wearing masks at all times, keeping within pods, so that people are exposing as few people as possible. So, and those direct facing employees that are runners out to the cars, the owners have rules too. They have to wear masks. We have to keep the owners in the cars as much as possible. We don't transfer things from the pets into the hospital and vice versa. So all those things that have been put in place are really making us feel, quite comfortable and safe.
Yeah. I remember at the beginning of the pandemic, they gave every employee, I think it was 3 or 4 masks or reusable masks to be able to protect themselves. And when it was at a time when we weren't really sure whether or not that masks were needed or not, but Ethos took a proactive approach and said, we're going to buy these and then we're going to make them available. And then to your point, Krista, about surgical masks, the objective was to be able to use the personal protective equipment for what it was intended for, while also protecting our employees. So really keeping that balance so that we could continue to provide life-saving care to our patients while also protecting our employees. So, yeah.
All right. So thank you so much for joining us, Jared.
Thank you.
Always love talking with you, and you have an amazing job.
Thanks.
Are you going to be at the fair? Are you going to be at the fair on Sunday too?
You better believe it. Oh,
all right.
yes,
I love
absolutely.
it. I love it. That's fantastic.
So everyone will get to meet the famous Jared.
Yes, with a mask. With a mask, of course.
With a mask, yes.
Yeah.
All right. Well, thank you for joining us again. And we do want to, of course, thank Ethos Veterinary Health and ask you to please go on to your favorite podcast service to rate us and review us and subscribe to us. And I'm Christopher Nolikin.
I'm Lindsay Renzuela. We hope to see you guys next time.